Hi, I'm Dr. Mark Lewinner with my lovely co-host, acupuncture partner, and mom, Dr. Andrew Lewinner. Mom, how are you doing today?
I'm doing well. How are you?
Doing great. Are you excited about today's topic?
I am excited about today's topic. How about you?
Absolutely. I love that we have tools available to us that can almost instantly, for the right situation, can relieve pain. And even though I have these tools at my fingertips, I sometimes forget about them.
That's
And
right.
I got a little bit of a reminder recently when I was doing some pull-ups. And last week we talked about muscle mass, and I've been very motivated since then. I've been lifting some weights, not heavy, but just enough to build some muscle slowly, carefully. And I've been doing some pull-ups, and I've been doing just a few slowly and carefully, but it's fun. And I was out walking over the weekend, and I passed by some monkey bars, and I thought to myself, let me see how many pull-ups I can do. So I wasn't warmed up. I may have been showing off a little bit. It wasn't really the ideal environment. And I did a few successfully, and I was proud that I was able to do them. And I noticed that a few minutes after that, my neck started hurting. And I thought to myself, oh my gosh, you wonder when you begin to get older, if when you have a little ache and pain, you're like, is this going to be the new normal? Is this going to turn into something chronic? Already kind of thinking about what this could mean. And fortunately, I didn't do too much. I just there was a little bit of a sprain. And I knew that I wanted to continue to be able to do pull-ups tomorrow. And I was focused on making sure that this pain wasn't going to interfere with the rest of my night and the days following. So I remembered a point on the hand, and you can easily find it if you just go here to the knuckles and you drop down. It is in this little depression here. So we're going to talk about that a little bit more, but I started pushing on it, okay? And I know a few things about myself. I know that I respond well to acupuncture and acupressure. I have personally and professionally found this point to be helpful, and I did not want this to be a chronic problem. So I really gave a lot of pressure here. And I did that for maybe 10 minutes or so, maybe 15. And I just kept rubbing back and forth. It felt like a bruise. Sometimes I would carefully move my neck. And then I stopped pressing there, and there still was a little bit of tension on the neck. I definitely wouldn't say that it went away, but the next day, zero neck pain. Now, this is a little bit of the mystery of East Asian medicine and self-care, is that I don't know if the next day I possibly would have not been able to turn my head and been in a real bad situation. I don't know. I do know that I pressed this point and I had zero pain the next day. So I love that for myself, but I also want to give that information to people who may not have it. And this point is one that I feel like everyone should know about. When I went to China in 1998, I stayed with a family in Beijing, and they knew that I was interested in acupuncture, and they just happened to have some acupuncture needles in their medicine cabinet. It wasn't necessarily important. I didn't even ask, why do you have acupuncture needles? But, and this is just my hypothesis, that some people just have acupuncture needles in their home, like we may have band-aids in our
That's
medicine
right.
cabinet.
Yeah.
Because when you are able to do acupuncture or acupressure very quickly after a injury or trauma, that is the best chance of getting quick results and sometimes total relief. Now, acupuncture is not going to help all injuries. It's not going to help all traumas, but it's important enough to be able to know about and give it the best chance to work so that you don't have future problems in the future. So this is what we're going to talk about today.
Yeah, it's hard to trust phenomena. One of the things that you said is, I'm not sure if this was doing that or that was doing that, or it would have been better tomorrow. It's like, does it really matter? It's like we have to learn to trust the phenomena and it's self-care. This point, whether you woke up the next day pain-free or not. It was like this point was a benefit. And like you said, keeping needles in the home is like a band-aid or keeping neosporin. You get cut, you want to put something on it to heal it. And we don't trust ourselves. There's that piece that we just don't trust ourselves. Or maybe we've, like you, have forgotten. Oh, wait a minute, there's a point here that I can do. Yeah, very great reminder, Mark, that we can do relatively small things to make big changes.
Definitely. And I'd like to talk a little bit about neck pain statistics for a moment.
Yes,
Uh, so, neck pain affects about 4.9% of the global population, making it a common musculoskeletal complaint. And it is more prevalent in women and middle-aged adults. In the US population, an estimated 30% of adults experience neck pain each year. Do you remember the last time you had neck pain, Mom?
I do remember the last time I had neck pain when I came off our flight from Japan.
That's right. Yeah. Around 50 to 85% of those who are affected by neck pain will not experience full resolution of the symptoms and may have recurrent episodes. Chronic neck pain, defined as pain lasting more than 3 months, occurs in about 10 to 20% of individuals. And some of the things that can lead to neck pain are sedentary lifestyles, prolonged use of computer, stress can significantly contribute to neck pain. Mom, how many times do you see people in the office and they tell you about their neck pain and they even do the motion and they're saying, I'm on a computer all day.
What I find is parents of children will often say, my son or daughter is complaining of neck pain because what are they doing? They're holding this and their shoulders are up because they're in some way their body is a little bit tense. They're not totally relaxed because they're engaging in conversation, which may be pleasant or not. And they're here all the time looking down, and it's these muscles that they're impacting as well as the muscles going up into their hand and up into their neck. So it's very common.
Yeah, for sure. It's stimulating. And when we're stimulated, that can be more activating to the sympathetic nervous system, that fight and flight response. And like you said, if we're texting, we might be bracing or we might be seeing things that we're excited about. But even though they're exciting and positive, we can be tense, or we might be responding to something stressful at work.
Yes,
And as we're typing these things out, we can feel this in our body. In fact, speaking of work, neck pain is the leading cause of work-related disability and absenteeism. Among office workers, the 1 year incident of neck pain can be as high as 45%. Neck pain ranks fourth globally in terms of disability adjusted life years among musculoskeletal conditions. And in the United States, the combined treatment costs of neck and low back pain exceed 87 billion annually. Neck pain, it's a big deal and it's very common.
that's right. And, the cost to our economy, when you start thinking about these things, is really very high based on people can't go to work and they can't participate. And it's a very significant thing. And if you can do something initially, how many times have I know for myself how many times I woke up and I go, oh, I must have slept funny. Just that little kink in the neck. And if you don't pay attention, and here you have a tool to help you pay attention, if you don't pay attention, it can go on and on to the point where I can't do my job now because I can't raise my arm, or pain is running down my arm. So it's a very significant symptom.
Absolutely. So, what would it be like if everyone knew about this acupressure point? So, the point is called Luo Zhen, and as I mentioned previously, it's between the second and third metacarpal bones,
I have a
and
graphic, Mark. Would you like me to show it?
yeah, yeah, absolutely. And it's on the dorsum of the hand in the depression just proximal to the second and third metacarpophalangeal joints, so the knuckles. And so you make that loose fist and just go right below, and you'll find the point. It helps with acute stiff neck, and it can help with limited range of motion and pain that is on one side. So from a East Asian medical perspective, stimulating this point Lojong helps move qi and blood in the meridians that influence the neck and back, even though it is on the hand. And this point is frequently used in urgent care style TCM clinics and often yields rapid results. That's been my personal and professional experience. This is a point that can provide immediate improvement in the cervical range of motion. I want to explain this using a modern understanding of what might be happening when we're pushing this point, Luo Zheng. And by applying pressure, this activates receptors on the skin and fascia, which sends signals through nerve fibers to the spinal cord and the brain. This pressure sends a non-painful touch into the nervous system, and that touch signal reaches the spinal cord and interferes or overrides the pain signals from the neck. It's like turning down the volume on pain. So the location of Lojong between the bones of the index finger and middle finger is in the area connected to the nerves that send messages to your spinal cord at the sixth and seventh cervical levels. Your neck and shoulders, including the trapeze muscle, are connected to the sixth and seventh cervical spinal segments. Now, this part is important and interesting. The part of your spinal cord that controls the neck is also the same part of your spinal cord that controls the index finger and middle finger where Luo Zheng is located. So when you press Luo Zheng, you're sending signals to the same nerve center that handles neck pain. This can calm overactive pain signals, loosen tight neck muscles, and make the neck feel better by distracting the nervous system. Simply put, pressing on an acupuncture point like Lojong, you're not just affecting the area where you're pressing, in this case on the hand or neck, you're actually sending signals all the way up to the brain. And that can help your brain respond better to pain by calming down the area that feel, process, and react to pain. Isn't that amazing?
That's great information. It really is. Yeah. Just how the body works all together. Yeah.
So I certainly didn't want to cause a little sprain in my neck, but from that experience, I am able to share this information. And I think many acupuncturists get into acupuncture because of a personal experience that they've had. I've heard a saying at a lecture that all research is me search. And I have experienced quick results with acupuncture. I remember when I was 16, I did acupuncture every week for a year. And at the same time, I was playing rugby and I hurt my knee. And I don't even know what happened to it. I know that my knee still clicks to this day. But I walked in there with a lot of pain and treatment was done. And the pain was essentially gone after the treatment. Now, this, again, I was young. It was a day or two after the injury, may have even been the same day. So there were some different factors, and I I want to be able to provide quick relief to all of my patients. That's not always possible.
That's
But
correct.
there are times that it is possible, especially if people know. And if they know how to care for themselves immediately, then the results can happen even quicker. This is just a public service message, if you
And a great one. I love that you were walking past a playground and you saw this equipment, and we forget to let our child free and going out and wanting to swing on the bars or do some pull-ups. We can call it different things, but you were letting yourself play. And that's the greatest healing of all, is to allow ourselves joy.
And I think as we age, that can be more challenging and there can be fear of injury. And in
Of
fact, I
injury.
did have
Yeah.
injury. So being more careful, not doing too
Yeah.
much, warming up. But we do need to push our body in different ways. And I'm seeing that more. And as we send that message, I want to make sure that the people who listen to this
Yes.
also have tools that they can use to immediately relieve pain. Next time, we're going to talk about a story of me at a water park where I broke a toe and I had a acupuncture friend there, and he did acupuncture, and it did not ruin the day. But if you are experiencing neck pain and you're in the Atlanta area and you'd like to try acupuncture, come and see us. We're Metro Acupuncture in Atlanta, Georgia, and we look forward to helping you feel better.
Thank you for your listening.
Thank you.